stigma, if it was removed completely, I don't even think we would then have to talk about mental health or physical health. We could talk about our health, our children's wellness. We could look at our community's health and wellness. The most important thing that Trillium Family Services does is that concept of being part of a community. Trillium was, like a lot of organizations, very prescriptive in our work in terms of thinking about how we worked specifically with people that had mental health issues. And I think now, when I think about who Trillium is in community, it's really more about working within community and not upon community.
The work of Trillium is so important because we really represent the full continuum of mental health care for kids and families, from our highest, most intensive inpatient settings down through our mental health promotions in schools and everything in the middle. And we're so fortunate that we can move kids and families through those levels of care in a seamless way.
When we fight stigma, we open up the conversation for the community to have about mental health. It allows people to feel less shame and engage in a conversation about mental health issues that they may otherwise keep private, and gives them an opportunity to open up the door to seek services that they may not ordinarily seek.
So whether it's around trauma-informed care or mobilizing community for anti-stigma work or to end discrimination for people with lived experience, Trillium is really brave and steps out in front to lead that charge. There were many years where we were doing it by ourselves, and then now it's so great. We have this branded cause, many people are joining us. It's a collective impact approach, and Trillium's leadership is visionary.
Our Keep Oregon Well campaign is really starting to get recognition across the U.S. and beyond, and really being seen as something that's really innovative and unique. We're putting that stigma to bed, which hopefully means that we can start to come together as a community and talk about these things that we're all experiencing and we're all affected by.
Where Trillium is leading the way is to go beyond that and to say we really want to be a social impact organization that is absolutely embedded in community. And I think what that does is it starts to engage people into conversations about what's happening in Oregon, and really importantly, what's happening to communities in Oregon. So there are 3 programs that we see as really being innovative, community focused, and that fit that concept of working within community and not upon community. The 3 programs are Keep Oregon Well, the Chrysalis program, and 3 to PhD.
Our clinical work has always been about meeting the community where they are. And so in the future, we'll continue to listen and be responsive so that we can provide services and supports that are relevant and that meet those ever-evolving needs.
So Trillium has been around for 150 years, helping children and families that whole time. We have at times been child caring for folks that had been abandoned, and then we were a mental health organization, and now we're out in community. And I think over the years, the basis of helping children and families hasn't changed, but how we do that does. I think our commitment to meeting community where they're at will continue to evolve how we deliver our services.